Hey everyone! If you're struggling with thinning hair or receding hairlines, you're not alone. It's something that can genuinely affect a person's confidence. By age 50, over 85% of people notice significant hair loss. But what if I told you the right supplements could reverse it? We've moved beyond just accepting hair loss as inevitable. Today we're breaking down the top 5 science-backed supplements to thicken, strengthen, and regrow your hair fast. We are diving deep into the biochemistry of hair growth and looking at compounds that have been studied to have a real, measurable impact. Stick around. This could save your hair. Alright, let's kick things off with a supplement that's practically a celebrity in the hair, skin and nails world, Biotin. You've probably seen it advertised everywhere from shampoos to gummies, but what is it really? Biotin, also known as vitamin B7, is a water-soluble vitamin that plays a vital role in your body's metabolic processes. It acts as a coenzyme, a helper molecule for several carboxylase enzymes. These enzymes are crucial for synthesizing fatty acids, breaking down amino acids, and creating glucose. Think of it as a key that starts the engine for some of your body's most fundamental construction projects. Without sufficient biotin, these essential metabolic pathways can't function optimally. Now you might be wondering, what does all this complex biochemistry have to do with the hair on my head? Well, it's directly connected. Hair is primarily made of a protein called keratin. The production of keratin is a highly energy-dependent process that relies on the very metabolic pathways that biotin supports. When you don't have enough biotin, your body's ability to produce the building blocks of keratin is compromised, which can lead to weaker, more brittle hair and slower growth cycles. So in essence, biotin isn't a magic ingredient that directly grows hair out of your scalp like a seed. Instead, it's a foundational nutrient that ensures your body's hair factory has the power and resources it needs to operate efficiently. It supports the infrastructure. If your body is a construction site for building new hair, biotin is the foreman making sure the energy supply is running smoothly and the raw materials, like amino acids from proteins, are being processed correctly. A deficiency can bring the entire keratin production line to a grinding halt, which is why it's so critical. It's important to understand this role because it manages expectations. Taking biotin won't suddenly give you a new head of hair overnight if you aren't deficient. However, for those with a genuine, albeit sometimes subtle, deficiency, reintroducing adequate levels of biotin can reactivate and optimize the keratin production process, leading to noticeable improvements in hair strength, texture, and growth rate. Let's zoom in on keratin production because this is where biotin truly shines for hair health. As I mentioned, hair strands are over 90% keratin. This is a tough, fibrous structural protein that gives hair its strength and resilience. To build this complex protein, your body needs to synthesize it from various amino acids. This synthesis is an intricate process and several steps rely on biotin-dependent enzymes. If you're low on biotin, this keratin infrastructure becomes weak and compromised. The result? Hair that's brittle, breaks easily, and struggles to grow past a certain length. Think of it this way, if you were building a brick wall, keratin is the brick. The amino acids are the clay, and biotin is the energy source firing the kiln to harden that clay into strong, durable bricks. If the kiln isn't hot enough due to a lack of biotin, you end up with soft, crumbly bricks that can't build a sturdy wall. This is precisely what happens to your hair strands. They become structurally unsound, leading to what we clinically observe as thinning, shedding, and an overall lack of hair density. Restoring biotin levels helps fire up that kiln again. Furthermore, biotin's role extends to the hair follicle itself. The hair growth cycle has 3 main phases: anagen or growth, catagen, which is the transition, and telogen, the resting or shedding phase. Biotin is thought to help prolong the anagen phase, which is the active growth period for each hair follicle. By keeping your hair in this growth phase for longer, you not only encourage more length but also contribute to a fuller appearance, as more of your follicles are actively producing hair at any given time, rather than sitting dormant in the resting phase before shedding. So, when we talk about biotin activating growth, we're really talking about a two-pronged approach. First, it provides the fundamental support for producing strong, high-quality keratin, which is the physical substance of your hair. Second, it helps to optimize the hair growth cycle within the follicle, encouraging a longer period of active growth. This combination is what leads to the visible results people are looking for: hair that is not only growing but is also stronger, thicker, and less prone to breakage and premature shedding. So, how much biotin do you actually need? For most adults, the adequate intake is around 30 micrograms per day. However, when we're talking about supplementation for hair health, the dosages you'll see on the market are often much higher, ranging from 1,000 micrograms all the way up to 10,000 micrograms. Now, this might sound alarming, but because biotin is a water-soluble vitamin, your body typically excretes any excess through urine, making it generally safe at these higher doses for most people. There is no established upper limit for biotin intake due to its low toxicity. The therapeutic dosages used in studies for improving hair and nail quality usually fall within the 2,500 to 5,000 microgram range. Starting with a dose like 2,500 micrograms, or 2.5 milligrams per day, is a reasonable approach for most people looking to see a benefit. It's important to be patient. Remember, you're influencing the growth of new hair from the follicle, which takes time. You'll likely need to be consistent with supplementation for at least 3 to 6 months before you can accurately assess the results, as that's how long a typical hair cycle takes to show visible changes. Of course, a food-first approach is always best. Before you even reach for a supplement bottle, you should look at your diet. You can find biotin naturally in a variety of delicious and healthy foods. Some of the best sources include cooked egg yolks. The cooking part is important, as raw egg whites contain a protein that inhibits biotin absorption. Salmon, avocados, nuts like almonds and walnuts, seeds and legumes. Liver and other organ meats are also incredibly rich in biotin. Integrating these foods into your diet is a great foundational step for overall health and hair vitality. But let's be realistic, modern diets can be inconsistent, and sometimes it's hard to get a therapeutic amount from food alone, especially if you're trying to correct a deficiency. This is where supplementation becomes a practical tool. When choosing a biotin supplement, look for one from a reputable brand that undergoes third-party testing to ensure purity and potency. This guarantees that you're actually getting the dose listed on the bottle without any unwanted contaminants, which is a crucial step for safety and effectiveness. If you're enjoying this video, don't forget to like, share it, subscribe, and click the notification bell so you do not miss any of our future videos. Thank you. Now, for a pro tip that can make your biotin supplement even more effective, pair it with zinc. Zinc is another mineral that is absolutely essential for hair health. It plays a critical role in hair tissue growth and repair. It also helps keep the oil glands around the follicles working correctly. More importantly, there's a synergistic relationship between biotin and zinc. Some research suggests that zinc is involved in the metabolic pathways that utilize biotin, meaning a deficiency in zinc could impair your body's ability to use the biotin you're consuming, even if you're taking a high dose. Think of it like this: if biotin is the fuel for your hair factory, zinc is part of the machinery itself. You can have a full tank of gas, but if the engine parts are rusted or missing, you're not going anywhere. By ensuring you have adequate levels of both, you're covering two critical bases for hair follicle function. Many high-quality hair supplements on the market actually combine biotin and zinc in their formulas for this very reason. Taking them together helps ensure that you're not just supplying the nutrient, but also optimizing its pathway for use. A word of caution is necessary here, especially regarding lab tests. High-dose biotin supplementation can interfere with certain laboratory tests, most notably troponin tests, which are used to diagnose heart attacks. It can cause falsely low results, which could be incredibly dangerous in an emergency situation. It can also interfere with thyroid hormone tests. Therefore, it is absolutely critical that you inform your doctor and the lab technician that you are taking biotin supplements before you have any blood work done. They may ask you to stop taking it for a few days prior to the test. Finally, while biotin is very safe for most people, it's always a good idea to consult with your doctor before starting any new supplement regimen, especially if you have any underlying health conditions or are taking other medications. They can help you determine if supplementation is right for you and if the dosage is appropriate for your individual health profile. Remember, personalized medical advice is always superior to general recommendations. Health is not a one-size-fits-all endeavor, and that includes the supplements you choose to take for your hair. Now let's shift gears from nutritional support to hormonal intervention. For many people, especially men but also many women, the root cause of hair loss isn't a deficiency but an excess of a specific hormone, dihydrotestosterone, or DHT. DHT is a potent androgen, a male sex hormone that is derived from testosterone. It's created when testosterone comes into contact with an enzyme called 5-alpha reductase, or 5-AR for short. This conversion process happens in various tissues throughout the body, including the oil glands of hair follicles. While DHT is important during development, in adulthood it can become a major antagonist to your hair. In individuals with a genetic predisposition to androgenetic alopecia, male or female pattern baldness, the hair follicles on the scalp are hypersensitive to DHT. When DHT binds to the androgen receptors in these follicles, it triggers a process called miniaturization. This means the follicle begins to shrink, and the anagen, or growth phase of the hair cycle, becomes progressively shorter. The result is that the hair produced becomes finer, shorter, and lighter in color with each passing cycle. Eventually the follicle shrinks so much that it can no longer produce a visible hair, leading to the classic patterns of baldness we see, like a receding hairline or thinning at the crown. It's crucial to understand that the problem isn't necessarily having too much testosterone, it's about how much of that testosterone is being converted into the much more potent DHT, and how sensitive your specific hair follicles are to its effects. This is a key distinction because it gives us a clear target for intervention, the 5-alpha reductase enzyme. This is where a supplement like saw palmetto enters the picture. Instead of just feeding the follicle, we're now talking about protecting it. We're playing defense against a specific hormonal attack. By inhibiting the 5-AR enzyme, we can reduce the amount of testosterone that gets converted to DHT in the first place. Saw palmetto is a plant, specifically a type of palm native to the southeastern United States. The active compounds are found in its berries, which have been used in traditional medicine for centuries, primarily for urinary and reproductive health issues. Modern science has identified that the fatty acids and phytosterols in saw palmetto extract have a very specific biological activity. They act as natural inhibitors of the 5-alpha reductase enzyme. This is the exact same enzyme that we just identified as the culprit responsible for converting testosterone into the hair-damaging DHT. By blocking 5-AR, saw palmetto effectively lowers the levels of DHT specifically at the tissue level, including in the scalp and hair follicles. This is a much more targeted approach than trying to lower overall testosterone, which would have many undesirable systemic side effects. The goal is not to eliminate testosterone, but to prevent its conversion into its more aggressive, follicle-shrinking metabolite. Saw palmetto essentially puts a roadblock in the pathway, reducing the amount of DHT that can reach and harm your sensitive hair follicles. The effectiveness of saw palmetto has been the subject of numerous studies, especially in the context of benign prostatic hyperplasia, or BPH, which is an enlarged prostate, another condition driven by DHT. The positive results in BPH research led scientists to investigate its potential for androgenetic alopecia. A 2012 study published in the International Journal of Immunopathology and Pharmacology found that a saw palmetto supplement improved hair growth in nearly half of the men with male pattern baldness who participated. While more large-scale, robust trials are needed, the existing evidence is very promising and aligns perfectly with its known mechanism of action. It's important to see saw palmetto not as a hair growth stimulant, but as a hair loss preventative. Its primary job is to stop the progression of miniaturization. By doing so, it allows the hair follicle to recover and potentially return to a healthier growth cycle. For many, this results in a stabilization of hair loss, and for some, it can lead to a noticeable increase in hair density and thickness as previously miniaturized follicles begin to produce healthier, more robust hair strands again. It's really about protecting what you have and giving it a chance to thrive. For hair loss, dosage is key. Studies use a standardized saw palmetto extract, typically 320 milligrams daily with meals. Consistency is paramount, effects take at least 6 months. Results vary, but studies show improved hair quality and reduced loss, especially at the crown. It's a natural alternative to prescription medications with fewer side effects. Now, while saw palmetto is generally well tolerated by most people, there is a very important warning that we need to discuss, particularly for a specific group of individuals. Saw palmetto can have mild antiplatelet or blood-thinning effects. This means it can potentially slow blood clotting. While this effect is usually minor and not a concern for the average healthy person, it can become very dangerous if you are already taking anticoagulant or antiplatelet medications, what we commonly call blood thinners. This includes prescription drugs like warfarin, clopidogrel, and even daily low-dose aspirin. Taking saw palmetto in combination with these medications could potentiate their effect, increasing your risk of excessive bleeding and bruising. This is a serious interaction that could lead to dangerous complications, especially if you were to have an injury or need surgery. Therefore, if you are on any type of blood-thinning medication, you should absolutely not take saw palmetto without explicit approval and supervision from your doctor. It is crucial to have this conversation to ensure your safety and avoid a potentially hazardous drug-herb interaction. Furthermore, because of this effect on blood clotting, it's recommended that you stop taking saw palmetto at least 2 weeks before any scheduled surgery or major dental procedure. This is a standard precaution for many supplements and medications that can affect bleeding time. You must inform your surgeon and anesthesiologist about all the supplements you are taking, including saw palmetto, so they can provide you with the correct preoperative instructions to ensure your procedure goes as smoothly and safely as possible. Honesty and full disclosure are non-negotiable here. Finally, as with any supplement that interacts with your hormones, it's wise to consult a healthcare professional before starting. This is especially true for women, as hormonal balances can be complex. While it's used for female pattern hair loss, it's not recommended for women who are pregnant or breastfeeding. Your doctor can help you understand the potential risks and benefits in the context of your complete health picture. The goal is to improve your hair, but never at the expense of your overall health and safety. Always prioritize informed medical guidance. Let's discuss collagen peptides. Think of collagen as the scaffolding of your body, crucial for skin, bones, tendons, and ligaments. It provides amino acids, the building blocks of keratin, essential for hair. Collagen supports the dermis where hair follicles reside. Supplementing with collagen provides the building blocks for stronger, thicker hair. It's about growing better hair, more resilient and less prone to damage. I am the kind of person that needs to see the evidence. What do clinical studies say about collagen and hair health? The existing data is promising and points towards significant benefits. A study looked at the effects of a specific collagen peptide supplement on women experiencing hair thinning. The group taking collagen showed an increase in hair growth and thickness. This moves collagen into the category of a scientifically supported nutraceutical for hair health. Some studies suggest that collagen can act as an antioxidant, fighting damage caused by free radicals, promoting a healthier hair growth cycle. The evidence supports the use of collagen peptides as a viable strategy for improving hair quantity and quality. Walking down the supplement aisle, you'll see collagen in many forms. The evidence points to hydrolyzed collagen, or collagen peptides, because it's more bioavailable. Look for hydrolyzed collagen on the label. Aim for 10 to 20 grams per day. Powder dissolves easily in liquids. Collagen comes from bovine, marine, and chicken sources. Pair it with vitamin C for maximum benefit. As we've discussed, collagen peptides are fantastic for building stronger, healthier hair. Because collagen is the primary structural protein throughout your body, you're likely to see improvements in other areas as well. The most well-documented of these is skin health. Numerous studies have shown that consistent collagen supplementation can improve skin hydration and elasticity, and the benefits continue to your nails. People who take collagen often report that their nails become stronger and grow faster. It's worth mentioning that collagen is also vital for joint health. It's a holistic supplement that reinforces the structural integrity of your entire body. Let's discuss the oxygen duo, iron and vitamin C. Iron is a core component of hemoglobin, a protein in red blood cells that transports oxygen. Oxygen is vital for hair follicles. Iron deficiency can lead to anemia, causing hair follicles to become dormant. Addressing iron deficiency can restart hair growth. Vitamin C enhances iron absorption, making this duo essential for healthy hair. So you're taking iron supplements? That's a good start, but vitamin C is iron's unsung partner. Iron comes in two forms, heme and non-heme. Heme iron from animal products is easily absorbed. Non-heme iron from plants is not. Vitamin C enhances non-heme iron absorption. It captures non-heme iron, making it easier for your body to use. Studies show vitamin C can significantly increase iron absorption, ensuring iron gets into your bloodstream. Vitamin C ensures iron does its job effectively, giving your hair follicles the best chance to thrive. Who is most at risk for iron deficiency impacting their hair? Women of childbearing age are at higher risk due to menstruation. Pregnant women need more iron to support the fetus. Vegetarians and vegans may not absorb iron as easily from plant-based foods. Individuals with gastrointestinal conditions may have impaired nutrient absorption. More iron isn't better. Iron overload can be toxic. Get your levels checked before supplementing. A blood test can measure ferritin levels to show your iron status. Your doctor will recommend a specific dose if you're deficient. Take 100 to 250 milligrams of vitamin C with your iron supplement to enhance absorption. even a small glass of orange juice can help. When it comes to iron, you must test, not guess. Taking iron supplements when you don't need them can be harmful. Excess iron can build up, leading to toxicity with symptoms like stomach pain and long-term liver or heart damage. A blood test is the only way to know your iron status. Ask your doctor for a complete blood count and a ferritin level test. Once you have results, you and your doctor can formulate a plan and investigate the underlying cause. Before buying iron pills, schedule an appointment with your healthcare provider. It's a responsible step that protects your overall health. Our fifth key supplement, omega-3 fatty acids, the inflammation fighter. Low-grade inflammation can occur anywhere, including your scalp, disrupting the hair growth cycle. Environmental pollutants, sun exposure, chemical treatments, and stress can trigger inflammation, restricting blood flow to follicles. Omega-3 ES, specifically EPA and DHA, resolve inflammation at a cellular level, creating a healthier environment for hair growth and prolonging the active growth phase. By improving scalp health, you improve hair health. The science and studies behind omega-3s. The connection between omega-3s and hair health is supported by scientific research. One key study showed that participants taking omega-3 supplements experienced a significant reduction in hair loss and increased hair density. Omega-3s support the scalp's natural oil barrier, preventing dryness and inflammation. Existing evidence points strongly towards the benefits of omega-3s, tackling hair health from multiple angles. For those looking for a holistic approach to improving their hair, incorporating omega-3s addresses a fundamental aspect of scalp health. So, you want more omega-3s? Where do you get them? There are excellent sources for every diet. For omnivores, fatty cold water fish like salmon, mackerel, and herring are the gold standard. Fish oil supplements are a popular alternative. Look for third-party tested supplements. Plant-based friends, you have options too. ALA is found in flax seeds, chia seeds, hemp seeds, and walnuts. The conversion to EPA and DHA isn't very efficient. Algae oil supplements are a fantastic solution. It's a potent, sustainable, and plant-based source of EPA and DHA. With omega-3s, the most important factor is consistency. Reducing inflammation is a long-term strategy. It takes time for omega-3s to incorporate into your cells and for your body's inflammatory baseline to shift. This can take weeks to months. Make it a non-negotiable part of your daily routine, just like brushing your teeth. Know that you are doing something incredibly positive for your entire body. Stay consistent, be patient, and trust in the process. We've covered a lot today. Don't buy all supplements at once. Here's your action plan. Identify relevant supplements for your situation. Start with 1 or 2 supplements. Give it 3 to 6 months of daily use. Take monthly photos to track progress. Assess results and adjust as needed. You're in the driver's seat. Subscribe for more science-backed health tips. Go reclaim your hair.